Hi, I'm Dr. Messina. Today we're going to be discussing lip augmentation. It's become one of the most popular services at my practice. Most of the time when someone's coming for lip augmentation, they want to just restore the volume that's lost in time, while others want to create an enlarged lip. And the amount of filling they get is directly related to the amount of filler that we have to inject. But first, if you like this type of information, remember to click subscribe and hit the bell to be alerted to future videos. When you go for lip augmentation, it's very important to find an injector who understands the anatomy of the lip. Filling has to be done in the appropriate areas with the appropriate amount of filler to get a beautiful result. What we want to see is something like this: restoration of volume. Or we could give a little more volume should you want a fuller lip and have something like this. But we definitely don't want to see something like this, where we have unevenness, bruising, and probably an occlusion of one of the arteries. Or this, a complete occlusion of the labial artery. This area is going to break down in time, and it's going to need a lot of treatment in order for it to heal properly. When evaluating lip anatomy, we have to consider what the normal anatomy is. Normally, we have 3 tubercles on the upper lip. I like to call them the pillows of the lip, and I explain to my patients that that's where we're going to be concentrating more of the filler. What we want to do is increase the fullness of the tubercles. Now you notice there's on the upper lip a right and a left tubercle and a central tubercle, which is slightly smaller than the right and the left tubercle. Should you make them all large and all the same size, you're going to lose, to a degree, that beautiful Cupid's bow that we see in the center of the upper lip. And you're going to start to get what I like to call a sausage-looking lip. It doesn't look natural, and it certainly isn't cosmetically pleasing. So they have to be mindful of the tubercles. Now, if we notice on the sides going towards the oral commissures, the lip gets markedly narrowed. And we have to put less filler into those areas, or else you will get a folding or almost a dog ear type appearance to the corners of your mouth. And sometimes the filler can slip and give you that, as we see in this picture here. When we look at the bottom lip, there are 2 tubercles. And of course, we concentrate on those 2 areas when giving volume to the bottom lip. We also have to be concerned with the vermilion border. That's where the natural skin ends and the pink lip begins. The vermilion border is often highlighted in lip filling procedures to give a little more body and a little more definition to the lip. Usually, I inject the body of the lip first, and the remaining part, which might only be 1/10 of a cc, I use to fill the vermilion border very gently. That gives a little definition to the lip itself. Now, it's also important to know the ratio of the upper lips. Here we have a beautiful comparison of Caucasian lip and African American lips. If we notice, the Caucasian lip is smaller on the top and larger on the bottom. The exact ratio is 1 to 1.6. So when we're filling the lips in a Caucasian patient, if we want to keep the normal ratio but a larger lip, we have to be mindful of how much filler we give to that upper lip and how much filler we give to the lower lip. The African American patient has a 1 to 1 ratio. So the upper lip is equal in size to the lower lip. That's also an extremely desirable look, and a lot of my patients want to have a 1 to 1 ratio. So in that case, it makes it slightly easier. We just put a little more of the filler, usually Restylane Kysse in my practice. We also have to examine the side view of the lip. The upper lip should protrude out slightly more than the lower lip. So when we're filling it, we have to make sure to maintain that ratio. or else from the side view, the patient is not going to look right. So we always have to make sure the upper lip not only is as full as the patient wants, but from a side projection, be slightly more projected than the lower lip. If you make them both equal, people aren't going to look and say, oh my goodness, look at that, the ratio is 1-to-1. What they're going to notice is there's something wrong with the mouth, we just can't put our finger on it. Now when choosing fillers, it's very important that we use the proper dermal filler when filling a lip. Remember, we want the lip to have a nice fullness to it, but we also want it soft. And remember, the lips are constantly moving. Therefore, we want something that's relatively malleable. And there are fillers designed specifically for the lip. Restylane Kysse is currently my favorite. I used to use Juvederm Ultra Plus XC. There's also Volbella, again designed specifically for the lips, and I found Volbella gave a beautiful lip, but the duration wasn't to my liking. So I might use Volbella if somebody is going to a party in the next few days and they just want to look super for that party, and fully well knowing that in a relatively short period of time the volume given is decreased, I'll use Volbella. Now, it's critically important that the injector understands the internal anatomy of the lip. There's an artery in each lip called the labial artery. The upper lip and the lower lip has it, and it comes in from the sides by those lateral commissures. The artery lies just below what we call the wet-dry area. The wet area is inside your mouth, and just going out to almost when it gets outside your mouth, you'll notice the lip is a dry area. That wet-dry border, just a few millimeters below it, is where that artery is. So when we're injecting, as you're going to see here, the injection is always closer to the outer edge than to the middle area. And we're just going a few millimeters down from the surface of the lip. Now when we're injecting, we have to be mindful of that labial artery. If the labial artery occludes with filler, it becomes very painful, and the skin of the lip, and probably the skin outside the lip, is going to blanch to a whiter appearance. Over the next 24 hours, it's going to become ashen and then darker, and eventually, should the artery remain occluded, that's going to get necrotic. In other words, it's going to break down. And you're going to require a lot of treatment to prevent scar formation and to allow healing to occur where your lip looks natural again. So it's critically important to know the internal anatomy of the lip. Now let's discuss the cost of lip fillers. The cost is going to vary depending on what part of the country you live in, and moreover, what type of an injector you're dealing with. If you're dealing with somebody brand new who's not a physician, they might be charging less, just slightly over cost, just to get some patients going. However, if you choose somebody who is a very well-known plastic surgeon in your area, then you're going to pay more for that. But you're paying for their skill, and you're paying for the safety and the outcome that you're going to get. And there are risks involved with it. Risks from infection to having a viral outbreak like herpes, or to having an arterial occlusion, or on the lighter side, just having an ugly outcome. So it's never a good idea to look in the paper and clip a coupon from somewhere for somebody that's very inexpensive. So that being said, I would say the average cost for doing the lips by a physician is about $800. And that would be one syringe. So now let's talk about how many syringes we might use. That question has to be answered by what the patient wants and what the patient expects. If somebody comes in who just wants to increase a little bit of the volume that they lost over time, then a single syringe of one of the fillers I mentioned before, divided between the upper and lower lip, will be adequate to replace that volume. Now say somebody wants to change their ratio from 1 to 1.6 to 1 to a 1-to-1 ratio and really increase the volume of their lip, well then we might need 2 syringes for that. When you see people with these huge lips, they're using more than 2 syringes. And I don't particularly care for it. I find it to not be that appealing, and it looks very unnatural. And usually what I'll do if someone requests that, I'll have them do 1 syringe at the office, see how they like it. We'll know in the next few days how it's going to be. If they want more, we could easily give more, as opposed to overfilling and then trying to take it out. Now, complications with the lips. Well, bleeding and bruising are the most common, and that makes sense. The lips are extremely vascular, plus they're getting punctured with a very sharp but small needle. Number 2 would be asymmetry. The dermal filler injections are graded. They're graded in tenths of a cc. So the injector has to be mindful of how many tenths of a cc they gave to each area. And unless the lips naturally are markedly off in size from one side to the other, you're going to give an equal volume to both sides. So you have to be mindful of what you've given already, looking at that tenth of a cc marking on your syringe. If you don't do that, then you run the risk of overfilling in spots and having a very unnatural, uneven looking lip. Plus, it also leads to some fullness that the patient can sense, especially if they put their tongue to it on the inside of their mouth. It will not feel right. Other complications could be the arterial occlusion, like I told you, but there is one specific concern in patients who get herpes outbreaks very easily. In that instance, getting the dermal filler into the lip can indeed cause an outbreak, and those patients should receive Valtrex. Infection is another concern. When we're doing the lips, it is a dirty area because we're working basically at the mouth. But the lips should be cleaned very well with alcohol before initiating any of the injections. But infections are fairly rare because the lip is so vascular. So now let's look at the video of an actual lip filler injection. So when we look at the video, we notice that we're going in below the vermilion border and above the wet-dry border. Often I start centrally, filling the right and left tubercle. Then I go out towards the commissures. But in this case, starting towards the commissures and then working towards the middle is fine. You just have to be aware of the amount of filler you're giving in each area. If you notice, we're below the vermilion border and above the wet-dry border, and maybe 3 millimeters deep. That's the best method of avoiding puncturing the artery, getting a bleed, or getting an occlusion of that artery. See, if you puncture the artery and it bleeds, the lip starts to swell, and then finally the normal anatomy becomes very, very difficult. And you would have to start guessing as to how much filler you should put in each side. So it's important to be mindful of all the blood vessels in the lip. So that being said, we get a very natural looking lip, or we could get a very full looking lip. It's just very important to know that should these rare significant complications arrive, the arterial occlusions, any type of infection, any type of herpes breakout, that your injector is capable and has the knowledge to treat these problems. Should an arterial occlusion occur, the treatment should be initiated right there on the spot. At the moment they're injecting it, they should notice there's these changes that we mentioned and go to correct them immediately. So I hope this has been a helpful video. I hope if you're thinking about getting lip filler injections, you'll know what to look for. And have a great day. Take care.